Okay, description, terminology. Compulsive disorder was previously classified as an anxiety disorder in DSM-4 in DSM-5, American Psychiatry Association. It is the flagship diagnosis of the obsessive compulsive and related disorders, a category of conditions with positively overlapping features. Definition: uh, OCD is defined is the DSM-5 by the presence of the obsessions or compulsions. Obsessions are persistent, intrusive thoughts, ideas, images, impulses, or doubts uh, that are experienced as unacceptable, senseless, or bizarre and evoke subjective distress in the form of anxiety or doubt. Although highly specific to the individual, obsessions typically concern the following themes: aggression and violence, responsibility for causing harm, contamination, sex, religion, the need for exactness or completeness, and serious illnesses. Most patients with OCD experience multiple types of obsessions. Examples of common and uncommon obsessions appear in Table 2. Compulsions are urges to perform behavioral or mental rituals to reduce the anxiety on the perceived probability of harm associated with an obsession. Compulsive rituals are deliberate yet excessive in relation to and not realistically connected with the obsessional fear. They are performed to neutralize as with obsessions. Rituals are highly individual examples of behavior. Rituals include repetitions, hand washing, checking, counting, and repeating routine actions. Example of mental rituals include the excessive prayer and repeating special phrases or numbers to oneself to neutralize obsessional fear. The rituals present example of some common and common complex rituals. Insight. People with OCD show a range of insight into the validity of their obsessions and compulsions. Some acknowledge that their obsessions are unrealistic, and while others are more firmly convinced, approaching delusional intensity, that the symptoms are rational. To accommodate this parameter of OCD, the DS5 includes specific specifiers to denote whether the person has a good of a hair, poor or no insight into the senses of their symptoms. Often, the degree of insight varies within a person across time, situations, and across types of sections. For example, someone might have good insight into the senselessness or have violent obsessional thoughts. It have poor insight regarding fears of contamination from chemicals. Tics also includes a specific to distinguish between people with OCD with and without tic-like symptoms or a history of a tic disorder, whereas in typical OCD obsessions lead to a negative emotional state such as anxiety or fear. Tic-related OCD is characterized by a distressing sensory, somatic state such as physical discomfort in specific body parts, face, or diffuse psychological distress of tension. The sensory discomfort is relieved by motor responses that can be difficult to distinguish from tics as observed in Tourette's syndrome. OCD from an internal perspective. The previous description highlights the experience of OCD from an individual perspective. Yet OCD commonly has an interpersonal component that may negatively impact close relationships, such as that with a parent, sibling, spouse, or romantic partner. This component may be manifested in two ways. First, a partner or spouse or other close friends or relative may make may inadvertently withdrawn to help or accommodate, with performing impulsive rituals and avoidance behavior out of the desire to show care or concern for the sufferer. Second, OCD symptoms may lead to arguments and other forms of conflicts within the relationships. Symptom accommodation. Accommodation occurs when a loved one participates in the pattings, rituals, answer resource seeking questions, performs cleaning, and checking behaviors for the pattern. Careful with avoidance strategies. Avoid place and deemed contaminated by the pattern, or she helps to resolve or minimize problems that have result from the pattern's OCD symptoms, e.g., making excuse for the person's behavior, supplying money for special extra strange subs. Accommodation may occur at the request of the individual with OCD, or it might be voluntary and based on the desire to show care and concern by reducing to OCD suffers and distress. The following vignette illustrates accommodation. Merry accommodation can be subject or over can extreme and exert in distress and non-distressed relationship. Even if there is no obvious distress, accommodation creates relationship system that fits with the OCD symptoms to perpetuate the problems. For example, accommodation might decrease a patient's motivation to engage in treatment that would require a great deal of effort and change status quo. It might also be achieved in way in which loved ones have learned to show affection for the OCD sufferer. Surprisingly, accommodation is related to more severe OCD symptoms and poor long-term treatment outcome. Relationship conflict. Relationships in which one person has OCD are often characterized by interdependence, unassertiveness, and avoidant communication partners that foster conflict. Typically, OCD symptoms and interpersonal distress influence each other. For example, a father's continuous relationship with his adult daughter with OCD may contribute to anxiety and uncertainty that increases the daughter's obsessional doubting. Her compulsive reassurance seeking and overly cautious behavior might also lead to frequent disagreements and conflicts with her father. Epidemiology. OCD has a 1-year prevalence of 1.2% and lifetime prevalence of 2.3 in the adult population. This is equivalent to about 1 in 40 adults Russia stage 2 occurring. The disorder affects women slightly more often than men, and the age of sunset, although earlier for males, is around age 19. On average, most individuals with OCD suffer for several years before receiving adequate diagnosis and treatment. Factors contributing to the recognition of OCD include the fear of patterns and to disclose symptoms, the fear of the professionals to screen for obsessions and compulsions during mental status examination, and difficulties with different diagnoses.